Our top story tonight, the state of Iowa will not adopt a federal rule requiring employers to mandate COVID vaccines. This means Iowa employers and their employees are not required to comply with the federal vaccine mandate. The commissioner of the Iowa Division of Labor says Iowa's current standards of not requiring the vaccine or testing are at least as effective as the rule set to be enforced by the Biden administration. The move coming just hours after the Supreme Court heard arguments over federal mandates. GOP-led states, businesses, and healthcare workers are suing the Biden administration, arguing the vaccine mandates are federal overreach. The Biden administration says the mandates are needed to protect employees, both vaccinated and unvaccinated. Justices, both for and against the mandates, sounding off on Friday.
Tell me what's irrational about rules of that nature when it is the workplace that puts you into contact with people that will put you at risk.
It appears that the federal government is going agency by agency as a workaround to its inability to get Congress to act.
Justice Gorsuch's position held by the majority of the court. Chief Justice John Roberts says the decision to mandate vaccines should be left up to Congress, not federal agencies. Governor Kim Reynolds applauding the move by the state's Division of Labor. She says the Biden administration is trying to, quote, dictate health care decisions and eliminate personal choice, causing our businesses and employees to suffer and exacerbating our workforce shortage. The battle over vaccine mandates coming as Iowa records a massive uptick in cases and the highest number of COVID hospitalizations in more than a year. More than 13,500 positive tests were added in Friday's data dump. Nearly 900 people are currently hospitalized, up more than 100 patients since Wednesday. The number of people in the ICU also rising to 176, up 15 from Wednesday's numbers.
The real issue right now is volume, as the amount of patients that are coming in associated with the COVID-19 and its Omicron variant are simply depleting hospital resources, staff, and bringing the hospital to a capacity that is not sustainable.
The nation's seen a massive jump in the number of children hospitalized with COVID-19. In fact, there has been a nearly 63% increase in those hospitalizations in just the last week.